Good evening, everyone. Happy Tuesday evening to you all. I pray all are doing well. Welcome to our webinar. Tonight's webinar is entitled Black Preterm Birth. This is a live event. You can connect with us via Zoom or on our Facebook platforms, but the event will be live, but not Facebook stream, but we will post on Facebook afterwards. So let me clarify that. And participants can join via Zoom. So today's, our topic is preterm Black birth. And the month of November is dedicated to Prematurity Awareness. So November 17th marks World Prematurity Awareness Month. So that passed a couple weeks ago, just about. And in California, Black babies are disproportionately born early, and preterm birth is the leading cause of infant death. In my history, actually, I can go back in that to the Black Infant Health Program when I worked in the 90s, and I folks to get women into early prenatal care to ensure that they did not suffer a loss, an early loss, and just to really try to educate them more about the importance of the first trimester and getting care from, the onset of pregnancy once you know. So I am Audra Jones. I am a Black maternal and infant health advocate and public health leader. You don't need to know about the education is there, but just to give you history of who I am. And so we could go to the next slide. So the Black Doula Consortium is made up of about, 7, 8 partners, including myself, the Center at Sierra Health Foundation, Blue Shield of California, Black Wellness and Prosperity Center, Her Health First, Frontline Doulas, and Diversity Uplifts, Inc., and the Black Child Legacy Campaign. And so we're here just to offer these monthly webinars to educate our community on some of the issues around Black infant and maternal health. Consortium goals. Our goals are to strengthen and promote California's Black Health Equity Network, listen to Black voices. So that's why we've invited you here. And that's why we like to switch up to a live webinar so that we could hear from you even as we have our guest speakers on. Increase access to information and resources, and target key stakeholders. We consider you key stakeholders as well as even those that are advocates or work in the maternal and infant health field. So why are we here? I mentioned it early, Black preterm birth. And so the key and why it's so essential, because we really want to avoid having our babies born too early, prematurity where it's possible, because prematurity is one of the leading causes of Black infant death. It's also leads to a number of health issues potentially for those infants that survive. And so we're here to really just talk about some of what can be done, some of what has not been done, and some of what we would like to see happen. So on tonight, we have these lovely women that I am proud to, I actually can officially call them my sisters. They're my sister friends, that's the STR at the end. And I love working with them, have worked with them on numerous projects, and just happy to have them as powerhouse and leaders in our community. So we have Mashariki Kudumu, who is the Director of Maternal Infant Health and the March of Dimes. Glad to have her on our AIM community team in South LA, South Bay, and all the work she does around the community action teams. And then we have another star, Miss Jessica Wade, my little mentee sister. I love her. Jessica is the founder of Mighty Little Giants. She's the founding president and CEO. She also has her BS as well as her CLE, Certified Lactation Education Specialist, and she's a certified doula as well. She most recently, you guys have to applaud her on this, joined the March of Dimes team. So she'll be working for those of you who are tapping in from the San Diego area. She'll be working up in that region. So our first guest expert today is, again, Mashariki Kudumu, who works as the Director of Maternal and Infant Health in the greater Los Angeles area for March of Dimes. She is an AIM steering and CMQCC committee member. She can give you what the acronym for CMQCC. AIM is African American Infant and Maternal Mortality. She's also a maternal and child health expert. Her education, she has an MA in public health from UCLA Fielding School of Public Health. That's her Master's of Arts, as well as her undergraduate degree in psychology and social welfare from UC Berkeley. And she is a trained doula. Welcome, Mashariki.
Thank you. Thank you so much for having me. I'm going to actually share my screen. So just give me a minute. And I'm happy to be here with all of you. And thank you, Ajwa, for that introduction. Some of the women that are on today are, some of the people that, I love the most in this work. And so I'm just very, just happy to be here and to share with you. So what I'm going to do today is just give you some background about what is preterm birth. Give you some data, talk to you about some of the experiences that we hear about from Black women in the community, and talk about what we can do, right? Because sometimes we hear so much about the data and not about the solutions. And so just about the March of Dimes. March of Dimes is one of the oldest and largest national organizations focused on mom and baby health. We've been around for over 80 years, started back in the 1930s by Franklin D. Roosevelt, really around polio, and then moving to looking at maternal and infant health outcomes. So our goals are to end preventable maternal health risks and death, as well as end preventable preterm birth and infant death. And in order for us to do that, we really need to close the health equity gap. And so I want to start off, and I sometimes have to ground ourselves by in me about the work and why I do this. And this is sort of my disclosure and why this work and why preterm birth is so important to me. So this is a picture from my Black graduation at UC Berkeley, go Bears, with my 3 sisters and my mama, who just celebrated her 80th birthday over the weekend. And I show this picture because of my 3 sisters. I have a sister who's a physician. So she went to Duke, got her medical degree from UNC, and she's a family medicine doc. So she actually delivers babies. I have another sister who went to Stanford, and she's a scientist. And I have another sister who graduated from San Diego State, and she is a counselor around addiction issues. And we all had our babies 37 weeks or less. So I have a sister who had, I have a nephew who's a 24-weeker. We have a set of twins who are 27-weekers, and I have another nephew who are 30-weekers, who's a 30-weeker. And so this is our story, right? So our, college education, our private insurance, our vegan diet, our home ownership weren't protective factors for us when we talk about our outcomes and the disrespectful care that we received in accessing perinatal care, being in the NICU. So I want to really ground us, and this is why the work is important to me. And so I show up in this work a little bit differently than some folks do, because the work is personal to me as well as professional. And so why is preterm birth important? And Ajwa sort of really raised as one of the #1 causes of infant death in the US. And we talk a lot about infant death, and I feel like we don't always talk about preterm birth. And for us to really move the needle and decrease infant death and infant mortality in the US, we have to impact preterm birth. And Ajwa talked about some of the complications. But one thing that we don't always talk about is the cost, right? And so caring for babies and caring for a mom, we talk about the medical care for a mom who gave birth preterm. We talk about the medical care, the social and educational care for a baby that was born preterm. And in California is $3.16 billion with a B dollars each year in California to care for these moms and babies. And that's about $75,000 per year annually for each baby born preterm in California. And so I always bring this up when we talk about the governor's budget, about issues around maternal and infant health, when we talk about our local budgets around issues around maternal and infant health, they really kind of they really pale in comparison of what the actual costs are, right? In terms of our educational, societal, and medical costs to care for our moms and babies that have adverse birth outcomes. And so when we are fighting for budget increases, when we look at SB 65 and what we're asking the governor to fund, this pales in comparison of the cost for preterm birth each year in California. And it's also important because not only are babies who are born preterm have complications, this goes later on in life, right? So babies that are born preterm have increased risk for health conditions in adulthood, such as cardiovascular disease, so heart disease, diabetes, hypertension, and high blood pressure. And so there's this cycle, right? So you think about a baby that's been born preterm that has complications such as intellectual disabilities or other health conditions, right? Then you think about the economic and educational opportunities that they might have, right? Then you think about if those educational and economic opportunities are decreased because of health concerns, that they might not have as much access, and there's that stress, right? And then that stress leads back to them having a baby that's born preterm. And so there is this cycle, right? And so for us really to, we can't just think of, preterm birth as it ends once the baby goes home. It really does follow the baby throughout its life course. And so these are some of the risk factors for preterm birth. And so one of the biggest risk factors that we need to know about for preterm birth is that having a prior preterm birth, right? So the risk factor is not because you're Black. The risk factor is not, because some health behaviors, there are some health behaviors, but not always. But the biggest risk factor is because you had a prior preterm birth. And why this is so important is that, I talk to moms and they have told me that, their third preterm birth, no one said anything to them. So they've had two prior to preterm births, they're pregnant for the third time, and no one even asked about their history. No one talked to them about if there were any clinical interventions or things that can happen to decrease the risk of having a preterm birth. And then also too, we find that moms are not being screened, and the doctor's office are not being asked the right questions. And so this is really important. And so if you are a mama who's had a prior preterm birth, it's really important that if you get pregnant again, that you let your care provider know about that so that they can treat you appropriately. And so some of the other risk factors are having multiple gestations, such as twins and triplets, chronic conditions like diabetes and hypertension, a family history of preterm birth. And when we talk about lower socioeconomic status, that really is about, the chronic stress is really about the lack of access that people have. And so it's not just so much the lower economic status, but being able to have like that lack of access to have the healthiest life possible. Lack of social support that leads to toxic stress and increased stress, and also a short pregnancy interval. So getting pregnant again 6 months after you've just given birth. And so every year, the March of Dimes puts out a report card. And this report card is really an update on the status of what's happening around maternal and infant health in the US. And so we give a grade for the US, we also give a grade for California. And what we found is that California has a B. And so for the first time in about 6 years, the preterm birth rate has decreased in the US and in California. And do folks, and you can drop it in the chat, if you can think of like why this might happen. Why do you think for the first time in 6 years, the preterm birth rate has decreased? And so I really do want this to be sort of an interactive, and this is a discussion. So drop it in the chat and let me know what you think. Why? But it's that decrease, that trend isn't equal across our counties, right? And so this is just some data looking at different counties across California. And so what we see is that the preterm birth rate did not decrease in LA and actually increased, and it actually increased across all racial groups, even though the preterm birth rate decreased in California and increased among Black and Indigenous women. And what we see is that we look at, especially, so I, in my role at the March of Dimes, I look at the region from Orange County up to Fresno and everything in between. And so we have these counties that are right up against each other. So folks live in one county, but they work in another county, right? And so we look at, Orange County, which has a preterm birth rate of 8.1, a grade we say A minus, but then we have Long Beach, which is right next door, right? That has a C. We have San Bernardino County, which is 60 miles from Orange County, that has a C versus that Orange County of A minus, right? And so what are some of the reasons that folks are living right up against each other, working in these different counties, but that have a different rates of preterm birth? So what's happening in those communities, right? When we talk about access to care, the quality of care, not only healthcare, but also too when we think about economic opportunities, when we think about air pollution and environment, when we think about transportation, when we think about educational opportunities, right? So we think of all, and so this is really important, especially in our work, that we can't just look at one county, one community and work on that when we have our folks, as we know, traveling, crossing county lines to work and to live. And so even though the preterm birth rate in California decreased, we saw the disparities ratio increase, right? So like I said, the Black preterm birth rate increased, as well as the Native American Indigenous preterm birth rate increased. And so I think this really looks at how folks were impacted by COVID, right? 2020 was a really difficult year for a lot of reasons. We talk about COVID, we talk about some of the social and racial unrest that happened, right? And when we talk about COVID, it's not just the health aspects of COVID, but also to the economic impact, right? And the stress, right? So folks losing their jobs, trying to work at home and then schooling your kids. We heard about partners in the community that had jobs when they were in the front line, whether they're medical workers or worked in retail, and they had, a pregnant partner at home and really having stress about having to be, go out there and work to provide for their family, and then come home and be stressed about whether or not they getting COVID and passing on to their partner, and wanting to just keep their family safe. And so this really, when we talk about the disparities ratio increasing, it really does shine a light on how COVID impacted folks differently, right? And so people talk about that COVID just really illuminated all of the inequities that we already know existed. Sorry about that. So the March of Dimes, a couple of years ago, and I worked on this project with Shantae, did some focus groups to understand what were some of the experiences of Black moms who had a prior preterm birth, to understand not only their patient experience, but also to what can be done both in the community and the clinical setting to increase access to clinical interventions to increase and improve care. And so what we found and what the moms told us is that a lot of them didn't know that they were at high risk for preterm birth. So that means that, we had moms that, like I said, had multiple preterm births and no one told them that having a prior preterm birth is the biggest risk factor, right? We had moms that would show up in the emergency room with classic signs of preeclampsia, swollen limbs, headaches, blurred vision, and being sent home and told nothing was wrong, or that a mom showing up in the emergency room with having contractions and were told that they had a UTI. Moms talked about that there were high levels of stress during pregnancy because of financial or family issues or societal issues. They didn't feel listened to by their clinical provider. They often felt talked down to and weren't given options. And some of the moms said they didn't understand the information that was given to them. So how can a mom make a decision around the care for her baby, around the care for herself, if providers aren't taking the time to really talk to them about what's happening, give them their options, and giving them the opportunity, if they can, to talk that over with their families? So how can moms really go through this life, go through the pregnancy, feeling that they can do the best that they can if providers aren't taking the time to really make sure they understand the information that's being given to them, that it is informed decisions and shared decisions. A lot of the mamas talked about that they didn't trust the healthcare system due to racism, disrespectful care, and prior negative experiences that either they experienced or families member experienced. And they also talked about the transition home from the NICU was hard, right? So a lot of mamas who've had to stay in the NICU talk about, being in the NICU is a very structured environment. You have the expert care from nurses and the clinicians and the doctors. And when you go home, you don't have that. And so having that transition home is really difficult. And so mamas needing more support as they transition home from the NICU. And the moms talked about they didn't have an opportunity to discuss their birth experience. So they didn't know, especially if they just went to the emergency room and then were having their baby. They weren't expecting to have their baby come early. They didn't have an opportunity to talk about what that meant. They didn't have an opportunity to talk about why it happened and how they can prevent it in the next pregnancy. And this trauma was long lasting, and they didn't have an opportunity to really sort of debrief what was happening to them and how that happened and how that affected them through after their pregnancy and years later. And so, what we've been doing at the March of Dimes is like partnering with some of our partners in the community, like Frontline Doulas and Diversity Uplift and Mighty Little Giants, to really provide an opportunity for moms to come together and to share and to be able to debrief their experience and get support, because the mom said that they needed that. So I'm interested, does this sound familiar to those in the audience? And drop it in the chat if you feel like this is anything surprising to you. Have you heard about this before, or is this new information for you? So I'd love to hear what folks think. And one thing that we have in our report card is this social vulnerability index. And so looking at where populations are greater risk for poor outcomes due to social determinants of health, due to social drivers of health, right? And so what we see is LA County, the Inland Empire, we see the Central Valley, we see parts of North and Sacramento. So we're looking at the communities where our folks live, right, that are impacted by housing, transportation, socioeconomics. And so when something like a pandemic happens, right, COVID happens, our communities are at more increased risk for poor outcomes because of the social vulnerability that we encounter. And so one thing that in our report card that we have are these policy measures, right, that really encourage states to adopt policies and legislation that will improve maternal and infant health. So, and what we do is we recommend policies that can be implemented, across the country. So we have Medicaid expansion, we have Medicaid extension postpartum, so up to 12 months, right? So not just the 60 days, 12 months, increasing access to midwifery care, doula coverage for Medicaid coverage for doula care, having perinatal quality collaboratives such as the California Maternal Quality Care Collaborative, having maternal mortality review committees as the one that I'm on in Southern California. So guess what? California is doing all of this, right? And a lot of this is happening because of SB 65 and what our partners have did to really to fight for this legislation. And so we're doing all the things in California and adopting these policies that can improve maternal and infant health, but our disparities ratio is increasing. Our racial disparities ratio is increasing. Then it really does behooves California, right? For us to think boldly, to be innovative, and to change. So I invite you to drop in the chat what you think needs to happen. Because I've had partners who said, I'm going to come to you and we're going to look at these policies and I want you to recommend other things in March of Dimes, because it takes us off the hook and makes us look like we're doing better or doing well when we see that disparities ratio increase. So if you have ideas of policies that we can enact, policies that we think we should be pushing forward in California, drop them in the chat and let me know what you think. And these are some of the recommendations that we talked about, what we can do to improve outcomes for Black moms and Black babies, to decrease and impact preterm birth. So listening to Black moms during pregnancy, the birth and postpartum, improving that quality of care. So it's not that you have a doctor that you can go to, right? Is that doctor on the bus route from your house, right? When you show up, if you show up because you took the bus and the bus was late, and so you were now 20 minutes late to your appointment, will that doctor see you? Or are they telling you no? When you show up, is the person at the front desk being rude to you? So just because you have access to care doesn't mean that care is quality, right? We talked about adopting policies that really demand accountability for respectful and responsive perinatal care. So it's going beyond just doing what SB 464 says, right? Or having like a 60-minute online training, but really looking at those policies and practices within healthcare systems that really do exacerbate outcomes for Black moms and babies. We also talk about mentoring and diversifying the workforce and making sure that Black women are in leadership positions, because one thing when we did this focus was we talked to community-based organizations, and a lot of the women were the ones who had the biggest touch points with the Black clients, the Black participants, but had the least decision-making power in their organization. So really, how are we diversifying the pipeline? How are we mentoring? How are we making sure that Black folks are in leadership positions in these white-led organizations? And then really also to developing partnerships between CBOs, community-based organizations, and healthcare settings. So I am always so surprised when we have doctors who don't know about Black infant health, when we have doctors who don't know about the Frontline Doula program or the AIM Doula program, when we have doctors who don't know about Cinemoms. So how, showing up for your prenatal care appointment, having your baby is one part of your care. And so really our clinicians have to take care of all of our care, all of us as whole, right? So that means they have to know where to send, where to refer their mamas if there's issues around lactation, housing, food insecurity, if they need support around their mental health. So what can mamas do? And I have some suggestions, and these suggestions are really, and I want to preface them with that really what we need to change, to move the needle, to decrease the disparities, to decrease Black preterm birth, we need a bold, innovative systems changes, right? And so it's not all on mamas, but what we hear in the community is for mamas feeling like they don't have options. They hear the numbers and they're scared to even give birth, to get pregnant. But we know that there are things that you can do. We want mamas to feel like they are empowered and that we are wrapping our arms around them as a community to make sure that they are living and thriving, so are their babies. So the first thing is to make sure that you tell your doctor, your midwife, anyone who's caring for you when you're pregnant about any adverse outcome that you had. So whether it was a preterm birth or infant death, because that really is important for them to be able to know how to care for you. Connecting with the doula, don't go at this alone, really. And there are so many, I heard from a provider and they said they had a Black patient and she wanted a doula, but she couldn't afford it. And I was like, we have frontline doulas, we have the AIM doula program. You know, make sure there are programs within at Fresno, and we think about Sister Web in the Bay Area. There are programs up and down the state and doulas who are helping our mamas and our families. So don't feel like cost is that you shouldn't seek out that care, and make sure you reach out to us and find out how you can connect with the doula. Know the signs of preterm labor and preeclampsia, right? So, you know, swollen limbs, headaches, blurred vision, that's not normal during pregnancy. If you're feeling like something's not right, speak up and be confident that you know your body. Increase your social support around by participating in BIH, Black Infant Health, or sister circles or faith groups. Seek out resources for housing, mental health, and food insecurity. And so when I say that, that is making sure that you reach out to us, right? The folks on this, the call today, people who are who are leading the Black Doula Consortium, reach out to find out where you can get resources from. Don't do this, don't feel like there's nothing out there for you, because there's so many organizations and people who can help you. Space your birth out to allow your body to heal, to build nutrients and address health conditions. And so one of the things that the research shows is that having 18 months between the time you've had a baby and the time you get pregnant again reduces the risk of preterm birth and low birth weight. And so that really gives your body a chance to heal, to build up nutrients, and also to address if you've had like a heart condition or high blood pressure in your pregnancy, because pregnancy can be hard on your body and your body really needs to heal. And so really talk with your provider about how you're going to plan your family in a way that is in tune with your values and your beliefs, all right? And be confident that you know your body. Speak up, as we said, and know your options to change care or file a complaint when receiving disrespectful care. So know that if you're going to a provider and they are not treating you right, or your family or your partner, what are your options of changing your care? What are your options of speaking up and making a complaint? And so really just encouraging you, mamas, to reach out to folks. Don't go at this alone, because we're here to surround you as your village. And then I just ask you and want you to think about, how do we develop these systems of respectful and responsive care? How do we increase social support for Black families? How do we improve the partnership between care providers and community organizations such as Black Infant Health, Frontline Doulas, the Black Wellness and Prosperity Center. And how do we reduce toxic exposure to toxic stress and racism? And so I invite you, again, drop it in the chat. Let me know what you think, right? That's how we can do this. Because like I said, we need bold, innovative action to really improve our outcomes for our Black families. And then I want to leave you with some resources from the March of Dimes. So we have some health action sheets around whether it's birth spacing or preeclampsia that you can download from our website and share with if you're a doula or you're with BIH, and then you can take these health action sheets and go over them with your care provider. We have a blog called News Moms Needs that has every week it's a different topic around all things perinatal. So it's preconception care, pregnancy, if you have a baby that's born preterm, if you have a complication, and we've actually added a component around COVID. And so this is evidence-based, easy to read information that's out there for our mamas and our families, and want to make sure that folks know where to go get the evidence-based information that's easy to read, because March of Dimes is one of the very few resources that you can get this information online around preterm birth and complications. And then we have our COVID-19 birth plan that a lot of the doulas and BIH use. And so what this really does is help facilitate a conversation with your provider about what's going to happen, and not only about your desires and wishes during pregnancy and birth and postpartum, but how will COVID impact that? And then we have My NICU Baby app that allows moms in the NICU, families in the NICU to be able to track their feeding, their weight of their babies, kangaroo care sessions, to have lists and organize for their postpartum visits, to track their care. And mamas and families can use this when their baby leaves the NICU as well too, as a way to organizing their care and also to track milestones and feedings for their baby. And then the March of Dimes has a few different online resources for families to be able to access online, because we know, especially during time of COVID, our traditional sources of support are always there. And we always know that when we reach out to folks who are experiencing the same experience, we don't feel alone. So whether through our Facebook, whether through Unspoken Story or shareyourstory.org, which is an online community for families that have been impacted by preterm birth, infant loss, or birth defects. And so I just want to thank you for your time and allowing me to be here today. I'm a resource for you. If I can do anything to partner with you for our Black families, please reach out to me. My email address is mkudumu, so MKUDUMU @marchofdimes.org. And I'm just, like I said, I'm happy to partner and share with you. And so just want to see if there's anything in here. Yeah, so thank you. So I love all the suggestions around increasing quality of care in the hospitals, about increasing diversity. So in the healthcare field and transportation, and looking at our social drivers of health. So thank you.
Well, thank you, Mashariki. What I neglected to do, you all, because my notes were all over the place, they were tripping earlier, is to tell you that Mashariki has diverse clinical research and nonprofit experience. So if you didn't know before, you saw it now. In maternal health, including HIV education and treatment, childhood obesity prevention, community engagement, and hospital quality improvement. And, her background is in social work. She's lived in San Francisco, New York City, and Latin America. I told you she's a trained doula. You could see that. Experience providing labor support to pregnant people living with HIV and AIDS, or who are part of the criminal legal system. She is a lifelong social justice advocate. You saw it here. She is committed to community-driven solutions to advance health equity and promote wellness. So we are grateful, thankful for Mashariki, who is a mom who lives in South LA and can be found most weekends cheering on her teenage son at his baseball and basketball games throughout Southern California. So again, thank you, Mashariki. There is a question in the chat from Gabby. If you can answer that, and then we will go on and bring on our next guest speaker. Again, thank you so much. Listen, you all, if you want her to come and speak, invite her out. She will share all the necessary details on the work March Dimes is doing and some of our community partners to solve this crisis of preterm birth. Thank you.
Thank you. And I'll drop, I see some couple questions, and I'll drop the information in the chat. So thank you for having me.
Great, thank you. So our next guest speaker is Jessica Wade. Jessica, as mentioned earlier, is the founding president and CEO of Mighty Little Giants, a national 501c3 nonprofit organization that advocates through providing support, education, and hope for mothers and fathers experiencing preterm deliveries resulting in long. Sorry, I muted myself. In the hospital and NICU. Mrs. Wade has spent the last 10 years working in her community advocating for underserved women, children, and families. She is a devoted wife, a mother of two, a mentor. Yes, she is. She is also a manager of maternal infant health initiatives for the San Diego County with an amazing organization, March of Dimes. She's also a certified lactation education specialist, as well as a certified doula. Her passion for the NICU families and mothers experiencing preterm births and developed as a result of her own personal experience of being hospitalized on total bed rest for 8 weeks prior to delivering her first son 12 weeks prematurely. Once her son was released from the NICU after his 143-day stay, she made a promise to God that she would do everything in her power to help families that experience similar situations. This is very true. I know it for as a fact. I have sent some families her way, and she's done an amazing job. So welcome, little sis, Jessica Wade.
Thank you, my Adjoa. I'm gonna go ahead and share my screen. Every time I get introduced, you guys, I'm like, who is that? Let me go ahead and, so thank you, my Adjoa. You know, you are like my big sister mentor. I appreciate you. Thank you guys for inviting me into this space. Like my Adjoa said, my name is Jessica Wade. I'm the founder of Mighty Little Giants. And so I am here today just to really share my story. I am a full spectrum doula, but most of my care is geared towards NICU postpartum support for our mommies and our birthing people. So I always like to start my presentations with my story, because my story is the foundation of the work that I do today. So I'm gonna back it all the way up. Me and my husband, when we first found out we were expecting, you know, we were so excited, went to our first doctor's appointment, and you know, the doctor said we were pregnant, but the baby had no heartbeat. So they wanted to do an emergency D&C, which is the procedure that gets done when you're aborting a child. And so for me personally, in that moment, I didn't want to get attached to something that wasn't there. So I was like, fine, go ahead, let's just schedule and do what we need to do. But thank goodness, you guys, I listened to my husband in this moment, because he said, you know, I don't feel right about it. We don't really know how far along you are. Can we wait? And so we waited 2 weeks, almost 3 weeks. And when we came back for the appointment, not only did they find 1 heartbeat, but they found 2. And so in that moment, I realized that I need to trust my body over the information that I was receiving. One of the baby's heartbeat was extremely slow, and everything hurt during my pregnancy, you guys. Like, from the point of we found the baby's heartbeat, just everything was hurting. And so from 7 weeks pregnant to 21 weeks pregnant, I went to urgent care 7 times because I wanted to trust my body. You know, every time I went, the doctors told me I was fine, put my feet up, you know, it's just normal pregnancy pains, but I was not okay. And, you know, we're told to trust our body, and we go into the doctor's office, and I literally felt like I was screaming in silence every time I left, because I knew something was wrong, but I just didn't really know what. And so we ended up miscarrying one of our babies at 21 weeks, which led me to a 58-day stay on hospital bed rest. And our son Marlon was born at 27 weeks and 6 days. And that these pictures are him and myself and my husband, just some of his NICU pictures. But during that time, we lost everything but each other. House, cars, jobs, I mean, everything that we could lose but each other. And from that experience, I truly feel like you don't go through something like that to go back to your day-to-day life. I have dedicated my life to supporting NICU families and, standing in the gap for our Black moms and babies. And so that is a little bit about me. And a little bit about Mighty Little Giants. So Mighty Little Giants is a national nonprofit organization, but it is community-based, and we advocate for mothers and fathers experiencing preterm deliveries, resulting in long-term stays in hospital NICUs. So our mission is to bridge and stand in the gap for families with babies in the NICU by embracing our core values, which are integrity, compassion, and encouragement, ultimately giving them the peace in the midst of their storm. That's all I needed was peace, and I just didn't know how to get to it. And so my education background is in early childhood administration. So most of the doula work that I do with my NICU postpartum families is through a theory. And I wanted to share one of my favorite theories. It's Matchlaw's hierarchy of needs. And it's a motivational theory in psychology comprising of a 5-tier model of human needs, often depicted as the, oh goodness, sorry. I have a problem really pronouncing this word, but the Matchlaw's higher, I can't say it, levels up within a pyramid.
Hierarchy.
Thank you.
Yes.
Thank you so much, Ajwa. I was like getting tongue-tied as I was practicing earlier, but anywho, I digress. And so from the bottom of the hierarchy upwards, the needs are physiological. So food and clothing, safety and job security, love and belonging needs, friendships, esteem, and self-actualization. And so most of my work starts with their basic needs, because I can't come in and talk about NICU until I see how the human is doing. So making sure they have shelter, making sure their electricity is on, making sure that their kids are fed. Just because you have a baby in the NICU doesn't mean that Edison is like, that's okay, you don't have to pay your Edison bill, or Verizon's like, that's okay, we'll cover your cell phone bill. Life still goes on even though you have a baby in the NICU. So making sure that our families are covered in that way, making sure that they have the confidence that they need to advocate for their family and for their babies. And so I just wanted to share a little bit about this. And so these are the key components to supporting NICU families that I believe, and this is something that I base my work around from mother to mother. And so the first thing that they need is compassion and respect, and providing culture competent care, support, grace, and respecting their decisions that they make for their baby. Just because it might not be something I would do for my own child doesn't mean that I don't need to respect it and give them the grace and the love that they need to advocate for their baby's needs. Providing them with mental support, self-care, navigating the NICU and life outside of the NICU. So providing them with emergency support for their basic needs. Like I said, just because you have a baby in the NICU doesn't mean that things pause. So making sure that they have the resources that they need. Have you applied for SSI? In the state of California, if your baby's way under a certain amount, you can receive benefits. Making sure that they created their boundaries with their family and with their relatives. I always say boundaries, you guys, creating boundaries can save your life. Create your boundaries, drink your water, you'll be all good, right? So creating boundaries, connecting them to resources, and building trust. If I say I'm gonna be there at 1 o'clock, you best believe I am outside at 12:55. And so that is something that I really base my support on. And then also giving them education and self-actualization. So lactation education, knowing that yes, your baby was born preterm, but that does not mean that we cannot get that oxytocin to flow so that you can have that beautiful letdown for your baby. Teaching them how to advocate for their baby and for their families, and assist families with building the confidence to speak up regarding their child's care. This is something that is so big, and it's surprising that almost, I would say, 95% of my doula moms who are moms of color always say that I don't know, I don't want to say anything because I don't want my child's care to be affected. But advocating and having your baby's care being affected shouldn't even be connected to each other. So teaching them how to do that in a way that comes across and that gets things done. And so I just wanted to put a little information on how do you request support? So we do have a website. Mighty Little Giants is a labor of love. I have a lot of volunteers that go in and we support where we can. And so you go to mightyllittlegiants.org, you select the program that you're interested in and submit a referral and somebody will be in touch with you. So we have our NICU support, our essential self-care kits, life after the NICU support, and we have our Mighty Little Angels support. So NICU moms deserve doula services too. I just wanted to put this flyer in because it's the truth. I truly feel like NICU moms deserve the postpartum services, not more than any other, birthing mom, but it's a very intense and stressful situation as it is. While you're going through your postpartum season, you need that support. You need someone to help you, give you that emotional support. Sometimes your partner might not know how to support you in that way because we're dealing with it separately and we're dealing with it different. So just having a best friend throughout your pregnancy and your postpartum season. So I also wanted to share our Mighty Little Giants essential self-care kits. So with some of the families I support families who are well off, who are financially stable, but then I have some families or single moms who are homeless and have multiple children while having a baby in the NICU. And I wanted to create a box full of peace where no matter if you're in a hotel room or you're in a mansion, you can experience a moment that you need. And so our Mighty Little Giants, we created the essential self-care kits to support mothers as they navigate through their postpartum season. The essential self-care kits are full of items that promote self-healing, natural remedies, curriculum from the March of Dimes through their NICU family support program, and resources for mothers experiencing postpartum depression. And so these kits are free. They're on our website, mightyllittlegiants.org. As long as we have supplies, we're sending them out. And then we also have our NICU support group chat. I work, my volunteers work. And so instead of responding to a whole lot of emails at the end of the day, I wanted to create a group chat that's consistent, that's constant, where the families that we support who are in the NICU, so some of my doula clients and the ones who are outside the NICU, they want to share pictures, ask advice, check in. We said happy Thanksgiving. What are you thankful for? We share our peaks of the week, we share our valleys of the week, and we pray for each other. This is a support group that is only for NICU families. It's not for any organizations, no organizations like needing referrals or anything like that. It's literally just a group of people going through the storm together that is a safe space. And so this is something that's kind of new that I have fallen in love with because I'm able to talk to my families and see the babies all the time. Oh my goodness. And so thank you guys. I didn't want to take up too much of your time, but if you have any questions, my email is jessica@mightyllittlegiants.org. And this is Marlon Jr. He's 7, you guys, and a size 12 and is taking over. So thank you guys.
All right, y'all. Sorry. Technical difficulties. Thank you for sharing. I mean, it's always powerful when I hear you share. If anybody has any questions, please drop them in the chat. I love to hear Mrs. Jessica Wade share her story and of how she founded Mighty Little Giants, and just the amazing work she's doing now, even further in our Black infant and maternal health community. I'm so very proud of her. I am so very proud of her and all that are involved in this work, including Mashariki. So if you have questions, drop them in the chat. I don't know, we had some guiding questions, but actually you didn't get to share, Jessica, some of those powerful stories of how and why you felt the need to be in the NICU. You shared some powerful, horrific things that have been done to moms and families in the NICU. And sometimes it's just important for people to hear and understand why we have these conversations, because we want people to know, like Mashariki shared, that you have a right to change your provider. You have a right to complain. You have a voice, and it shall be elevated about your own needs and those of your children. So if you don't mind, I would love for you to do that.
So, oh my goodness, Matchlaw, you know, I have so many. Okay, so I can think about one of my moms who's actually in our group chat, and I still keep up with her and her beautiful baby. She had her baby was in the NICU in the midst of COVID, right? Her baby was in the NICU for 344 days. And I met her last Christmas when we delivered gifts to the NICU. But so this particular mother was a mother of color, beautiful, dark-skinned mom, and her spouse or her husband was mixed with Caucasian and Black. Doctors never seen the spouse because her spouse had COVID twice, so he was not allowed in the NICU. But one day she overheard her doctor say, "This can't be her baby. She's too Black to be that child's mom," you know? And so in that moment, like, first of all, the audacity, right?
Right.
What do you do in that moment? So my client, she called me that night and she told me, "I don't know what to do. I don't want to speak up because I don't want my baby's care affected." And then, so from that, I told her, absolutely not, that cannot happen. And we went through the chain of command and didn't take that. And now with the hospital that she was at, she's actually helping them create a plan with the doctors when it comes to following the protocol of SB 464 and making sure that everything is taken care of. They didn't even have a plan to deal with it. They asked her, "What do you want to happen? What do you want to see happen to this doctor?" And she's like, "That's not my place," you know, but she felt like when she walked into the NICU, her baby was a skeptical, right? Now they're looking at the baby. Now they're looking at the mom. Every time she comes in, she's already dealing with the stress of having her baby in the NICU and having another child at home that can't come and visit the NICU. We're in COVID, that child's doing school alone at home. So the amount of stress that was added caused her milk to go down. She wasn't lactating as much. It caused so many different things. So that's one story that I can share.
Thank you. I wanted to ask too, when we talk about risk factors of preterm birth, some of the risk factors are beyond mom's control. What can you and Mashariki, if you guys can have a conversation and share, what can the providers or family, keeping in mind single moms, teenage moms, do about those risk factors to help moms reach a full-term pregnancy?
Right. So I think, what we talked about is one of the biggest risk factors is having a prior preterm birth, and then also looking at some of the stresses that folks have in life, looking at health conditions such as, diabetes or high blood pressure. So really is, before you have a baby, thinking about getting in the best possible health that you can be, and really seeking that support to be able to get in that best possible health. And reaching out to, the community resources, whether it's like WIC or BIH, and letting your providers know if you have any chronic health conditions, if you've had a baby born preterm. So those are some of the things that folks can do, but also to knowing, right, it's not just on the mamas, right, it's on our healthcare system and our society to really create this environment where Black mamas can live and thrive and have healthy babies, right? So I think there's some things in terms of, addressing chronic stress, seeking support, addressing health conditions, but also to knowing that we need systems of care that are respectful and responsive.
I totally agree with you, Mashariki. And like you mentioned earlier, having our pain taken seriously. We can prevent so much if people just listen to us, because we trust, like for me, I trust my body. I went to 7 different urgent cares and nobody was listening to me. So respecting our voice, respecting and taking our pain seriously, and just treating us as human, treating us as a part of your family. That's what I feel.
And Jessica, I want to bring up a good point that what I've heard what I've told people, with our COVID-19 birth plan, you can take that birth plan into the NICU, right? So if in your birth plan is you wanted to breastfeed and you had an unexpected preterm birth and your baby's in the NICU, take that plan and talk to your care providers about, breastfeeding, about lactation, about skin to skin. So your needs and desires don't just end because you've had a preterm birth. And then how can doulas help our moms in the NICU? Because I think especially, with SB 65 and seeing doula care, being a Medicaid benefit, we're going to see more doulas in the hospital, and maybe more doulas in the NICU. And so, and I've heard from folks in the NICUs that doulas aren't in the NICU, but I'm like, I know some doulas that are in the NICU. You probably might not know they're the doulas, right? But just how can doulas advocate for families in the NICU that have had a preterm birth? If you want to just talk about that a little bit more.
Yeah, Jessica, you can answer that. You just did that for someone from me that I referred to you, whose baby, Joy Linda, is coming along well. Even, the father has gotten involved. And so lots have happened and changed. And the mom has been blessed with a number of resources. So you're on mute. I don't know if you were going to say something, but you're on mute.
One thing so you're saying just how have I advocated for moms who have babies in the NICU?
As a doula. I think
doula.
she was saying as a doula. Mm-hmm.
As a doula who's had a baby in the NICU, not taking no for an answer is something that I felt like I had to do, especially because I'm like leaving my baby in the care of these, of the doctors and the nurses, not taking no for an answer and learning what the chain of command is, being present with the families or the mommy or birthing person during rounds, if they're allowed to have a support person there with them, it's something that I've done. And I feel like it has helped with they do their rounds, and after we discuss what happened in English, you know what I mean? We're able to break down the terminology, even advocating for families who English isn't their native language, right? So even if they say that they don't want an interpreter, asking for them to bring someone in that can advocate as well. Those are some of the things, my Mashariki. I hope I answered that right. Okay.
No, because I think sometimes people don't know how, I think families don't know how doulas can help them. And, even if they are having a high risk pregnancy, that doesn't mean they can't have a doula. And if they have an unexpected preterm birth, how the doula can support them once they're in the NICU.
And you know what else, my Mashariki, that I've come across is for lactation, for trying to breastfeed, you can't, as long as the baby is not intubated, as long as the baby is, if the baby is just on oxygen, you can try to latch that baby on to the breast. And that's something that we have advocated and have pushed for. And then at times I've had clients where the doctors or the nurses that are there with them during the day say that they don't have time to do skin to skin, they don't have time. And it's well, what do you mean? We've had to advocate to have the baby schedule kind of shifted to fit if the mom can only get here between 12 and 2, we need to switch around these feedings so that this mommy can do her skin to skin with her baby. So really advocating for the needs. And if a nurse or a doctor says they don't have time, really pushing back and saying why? Saying why and questioning and being okay with that and doing it in a respectful way that it gets through.
Yeah, and that's so important. And so when we talk about sort of these policies and practices that really kind of dismantle racism and exacerbate poor outcomes, right? It's what's your NICU visitation policy, right? So if your NICU visitation policy is at 9 to 5 and folks work, and they can't be there to, for lactation, skin to skin. And then the narrative is that this family doesn't care about their baby because they're not showing up, while as your hospital system is not making it equitable, not making it accessible, right? For all families to show up and care for their baby. So important.
So good. And you know what, Mashariki, look, I know we're over time, but we could talk about this all day, but I had a particular client who has birthed 11 kids and has 10 living and one mighty little angel. And what she went through her birth by herself and lost her baby by herself. And the hospital was focused on the fact that dad hasn't come to visit. And then pushing, well, where are the kids? Where are you guys staying? Oh, you guys are homeless in between houses right now. Instead of saying, here are these resources, here's some peer-to-peer grief, causing more anxiety. She didn't even want to go to the NICU, and so just really focusing on the needs of the mommies overall well-being. And we'll get to the resources that will come, but you have to build that trust. They're not trusting a lot of the hospital staff because they're looking more so towards their circumstances than the baby, the NICU, the postpartum, and the healing.
Right.
Thank you. You know what? I just wanted to say, see real quick, if we had any moms on here that wanted to share or, wanted to, ask any questions of you, especially if there are any new moms or anyone here that, because us, we could really talk about this thing. And that's why I step back, take myself off camera and mute and let y'all do your thing, ask you just a couple of questions and just go for it. One of the things Gabby said in there, hey, Gabby, good to see you.
Hey, Gabby.
There's such a lack of compassion from so many providers. It's heartbreaking. It is very true. In my recent health experience, which is not pregnancy related, I can tell you some people do not need to be in the business of health and helping because they don't know what to say or do. They have gotten into the business of really, critical behavior and not really looking to really help people partner together for your health, right? Partner together to improve our systems. We know that I would love if everybody saw this. It was Escape Fire. And I saw it years ago. It's probably been almost 10 years. And it talked about the failing healthcare system in America. And it's still true today. If you go and look at it, it's such a great film. It was a documentary. I just wanted to see, did anybody, ladies, Erica, Kata, say they wanted to speak up? I see Christina said something about, thank you, Jessica. We have so much to improve on behalf of our patients. You wonder if anyone ever sat down next to that woman and just listened. Exactly. That's what we're here to do. Some of us, some people have the skill for it. If you know you don't have the skill for it, then get with people who have the skill and be able to refer. Sherry Ann said the system needs so much improvement. Christina's asking for you to place that name in the chat again, but you are very right, Sherry Ann. The system needs so much improvement, period. We're seeing that period in our healthcare system, especially with what we're dealing with now in the midst of a pandemic, and just period, the education and awareness. I don't want to say Miss Hawkins' name wrong. I'll just say Hawkins is the last name. Says Jessica is so amazing and such a great mentor. Mighty Little Giant supported one of my clients. Yeah. Oh, the movie. I'm sorry. I'll drop it in. Thank you, my Shariki. She did. She dropped it in the chat. Escape Fire. And see if you can find it somewhere. It's really, really a good film. I saw it. A hospital actually showed it. St. Francis Medical Center over in Linwood.
I think too, one thing.
Go ahead.
No, I was going to say, when some of the birth story sharing circles that we've had and the work with Cherished Futures, I think, so there's two things I want to say. I think we have to realize that, care providers and hospitals and clinicians have to realize that people are people, right? And so I think people just get into like this, road, just going through the motions and not realizing that every baby is sacred to that family, right? Every mama is sacred to that family. And we have to sort of like step back, right? And really treat each person like that. And when we're talking, about the communication and explaining things, just slow down. And it's really just slow down, explain it in clear language, give people options, let them have time, like Jessica said, sort of think about things if they need to, because that is, what what's sort of missing, and I think most providers do, care about their patients and outcomes, and people just go, sort of get and like go on remote and sort of forget about the human factor. And the other thing is about diversifying the healthcare field. And that is so important. I mean, there's research and data that shows, right, the congruent care, racially and culturally congruent care yields better outcomes, right? So babies in the NICU who are cared for by a Black neonatologist had better outcomes. And so, we hear our Black mamas and families know that when they're in a NICU. And so we hear about them looking for the Black doctor, right? Because mamas have said to me, like, I'm looking for the Black doctor, I'm looking for the Black nurse, because I know then I can go home and sleep because they're not going to let my baby die on their watch, right? And so this is serious. And so when we think about how we're diversifying the workforce, what are the systems and programs that we're, and this starts, right, like preschool on up, how we're making sure that we have the pipeline for folks, Black people, to get in the healthcare, and how we're mentoring them once they're there, and how people are moving out of the way and giving people leadership roles and responsibilities and succeeding power so that, Black people can lead with example and provide care. So I think I just wanted to bring that up too, that it's really, you can talk about changing systems and reducing disparities if it's just, a group of white people talking about it. It's not gonna do anything. And if all your leadership is white, it's not going to make the outcomes. And so we really have to think about how we're making sure we're diversifying the workforce and how we're providing voices for our Black patients, our Black providers within your healthcare system.
Absolutely, absolutely. I'll wrap up on that. Unless Jessica, you have something you were going to say.
Okay, I'll be super quick, but
no, take your time.
I just wanted to share because I literally just had this experience with my husband 2 weeks ago. I went with him to a pre-op appointment, right? I'm like, Mama Bear, I need to ask the questions. And we go in, you guys, and literally it took us like 10 minutes to get there. And the doctor told us about the procedure, like within 5 minutes, it was moving. And I said, sir, are you in a rush? Like, I had to pause him. And he said, why do you have questions? And I'm like, well, yes, you're getting ready to operate on my husband. Like I said, this literally feels like a transaction and we're going to go get a second opinion. And we just left. But I had the confidence to do that because I know, like, I just felt the energy in the room. But like, and then he said, you guys have Medi-Cal, right? And I'm like, well, even if we did, that's fine, right? But no, we have commercial insurance. But like like he just assumed everything about us. He said, oh, who are you? Are you girlfriend? Are you who? Like, he didn't introduce himself. That was how he came in the room. And I said, okay, this is just gonna go left. I already know it. But the fact that I had to ask him if he was in a rush, and I told him this felt like a transaction. Like, what's the procedure? What do we need to do before? Like, he didn't go through any of that, And so when you said just to slow down and like, we're human, that just touched like my heart because we are getting a second opinion outside of the area because of it.
Yeah, I mean, I think I'm glad that you are. I know that I have a great provider. I can't say that everyone in that system does a great job, but I have a great provider, right? And this person is non-Black, but for the most part, I've always, I am like most, that I want to see someone that looks like me, that feels like me, has probably shared very many experiences like me. And that's what a lot of the work we were doing in LA when we started the AIMCAT, is that the community came together as well and said, we want to see Black leadership. We want Black people up front and speaking. We want Black folks supported in their leadership because we have been doing this work. We do know how to do this work. And we tend to not be supported, or we tend to be tokenized in those workspaces and places. And so we're looking to increase the Black maternal healthcare workforce. And we've done that in a number of ways, even through the doulas, and some of the trainings were offered through fundings that we had through LA County, through the Department of Public Health, through First 5 LA, through Department of Health Services. and some other resources that we were able to really put forth for our community. I wanted to just go back really quick, 2 comments, and we're going to wrap up. And I'm glad you spoke up for your husband. It's good. That's what you're supposed to do. 2 became 1. And in that oneness, you said, hey, listen, you're not just going to cut on my man and not even, acknowledge me, us, make me girlfriend. You haven't even, wait a minute, sir, slow down. Send someone else in, like send in someone first, your assistant, and then you come in when you're really ready to sit down and talk with us, because this is serious business, because not everybody wakes up from surgery. And so Christina has said earlier, please remind yourself you're a customer, whether it's commercial insurance or Medi-Cal or other, you're a customer. Just like you said, when he asked about, oh, you have Medi-Cal, first of all, you should have read the chart or the information, and you should know before you come into this room with me. Then Imani said, yay, Jessica leading the diversity front with the internships. Super excited to help and be a part of everything being discussed today. I know you are, and we're glad you are. Then Christina said, I think it's important to look at what will be happening in reducing racial inequity space in the NICU and in maternity care. I heard a story today about a project where they reduced time to skin from 21 days to 7 days for non-English speaking Hispanic mamas. Wow. Digging into the reasons underlying that disparity was a big part of figuring out how to improve time to skin for that particular population. Absolutely. 21 days to 7 is a lot. So yeah, no, we are going to continue to host, hold, convene, bring all of you to the table, elevate the work that you're doing, ask the pertinent questions, and be just, a resource and a connection together, in ensuring that we save Black moms and babies, that we elevate, what Black fathers and what they do and how they're involved, and all birthing persons, that we encourage and support our entire Black community. And so, ladies, if you have any parting words, I'm going to make sure we wrap up at this point. But if you have parting words, please feel free to share. Okay, all right, Jessica, go ahead. Nothing? Okay, well, let them know how to reach you. Drop it in the chat. Mashariki, give them your information. Did you have anything you wanted to say?
Yeah, I just wanted to, thank you all, and just, really remind folks that, figure out how we activate our village and wrap our arms around our families, that they're not in this alone, that there's so much support, like on this, call today, this meeting today, and just really to reach out and, for us all to just work together, like I said, for some bold, innovative change. So please, I'll drop my contact in the chat, but just know that, we are here holding space for, all our preemie warriors and their parents and our families in the NICU. Thank you.
Thank you so much. Much obliged with that. And you're welcome. And thank you for joining us. We're very appreciative. Shantae and I are like super grateful to this work that really came out of the mind and heart of our sister friend, Kendra Montgomery Block, who was with Sierra Health Foundation and who has since moved on. And then we brought in some of our partners and colleagues. And so super excited to see this work going forth, and we'll continue to keep sharing with you. Thank you, Sherry Ann. And I believe someone asked, you might have asked where you can get a copy of this. It will be posted on the Black Child Legacy page. I will repost. I believe it's going to be on the Black Wellness and Prosperity Center page, and we'll keep reposting these. So thank you again. And so with that said, I want to say, also, Kata dropped in the chat, if you guys can, please share any experience, data experience with preterm birth and COVID. We would like to hear from moms with their different stories and sources on how COVID impact their pregnancy outcome. Again, our consortium partners are the Center at Sierra Health Foundation, Blue Shield of California, Black Wellness and Prosperity Center, Her Health First, Frontline Doulas, Diversity Uplifts, Inc., Black Child Legacy Campaign. I am one of the partners and members of the group. And so I thank you very much for your conversation with us today, taking the time out, Mashariki and Jessica, to come and talk to us about this painful reality. Thank you to our participants for joining us this evening, joining the DC, Black Doula Consortium, BDC's webinar. We want to thank our partners for being a part of this work and helping us raise these important topics. This is so critical to us continuing. We also want to encourage you to share your voice through community engagement forums. This helps our advocacy. You will find them in the chat box. Further, our last slide. The next Black Doula Consortium event will be announced soon. It'll be happening in December. It is our last one of the year. And we look forward to you learning more about that. You will find it on either Black Wellness and Prosperity Center's social media pages, as well as the Black Child Legacy page. And thank you again for your time. Please don't forget, in order for us to continue to build this work, to build healthy neighborhoods, to build healthy women, to build healthy babies, we need your support. And to curb preterm birth rates, we have to start giving the attention to our women and babies, the attention that they deserve and the acknowledgement that they deserve. And we have to continue to wrap our arms around pregnant and birthing parents and persons to ensure that not only our babies survive, but the moms that have carried them to this side of the world, that they too thrive and survive, as well as the partners and fathers that are there with them. So again, thank you. Have a great evening, and we look forward to seeing you again soon. Peace and blessings, folks.